Good, happy Tuesday evening and happy St. Patrick's Day, everyone. I'm Riley King, and welcome to this Tuesday evening edition of the Riley King Newscast, right here on the Riley King Network. It is March 17, 2020. We have a lot of news to get to this Tuesday evening, so let's begin. First up, U.S. coronavirus death toll reaches at least 100. Here's the latest. There are more than 184,000 coronavirus cases in 159 countries and territories, according to the World Health Organization. More than 7,500 people have died worldwide. In the United States, there are at least 5,130 cases in 49 states, Puerto Rico, and the U.S. Virgin Islands, and Washington, D.C. The U.S. death toll has climbed to at least 100, with more than half of the dead from Washington state. President Donald Trump declared a state of national emergency in response of the outbreak on Friday. Several states are closing bars and restaurants, but encourage restaurants to offer takeout and delivery. Some states have postponed primary elections. The White House recommended that people don't gather in groups of more than 10 people. Canadian Prime Minister said he will close his country's borders to non-citizens and people who aren't permanent residents, but Americans would be exempt. COVID-19 in New Hampshire. Let's take a look. Number of people in New Hampshire who have tested positive for COVID-19. 195,957 number of people worldwide who have tested positive. 0 number of deaths from COVID-19 in New Hampshire. 100 number of deaths from COVID-19 in the United States. And 7,886 number of deaths of COVID-19 worldwide. In Grafton County, you have 5 people that have it, 1 person in Carroll County, 10 people in Rockingham County, and 1 person in Hillsborough County. The common symptoms: fever, cough, and difficult breathing. How it spreads. And prevention tips. New emergency orders ban utility disconnections, evictions, unemployment extended. State officers protections to those who lose income during COVID-19 outbreak. Governor Chris Sununu announced Tuesday new emergency orders intended to help people who are struggling financially during work slowdowns. Effective immediately, utilities in the state are prohibited from disconnecting any homes or businesses throughout the duration of the emergency. The order applies to electricity, gas, any other fuels, phones, internet, cable, and water. Evictions and foreclosures are temporarily prohibited. Immediate unemployment benefits are being extended. Anyone in the following situations will now be eligible for state unemployment. If your employer temporarily closes due to COVID-19, individuals that need to self-quarantine or are directed to quarantine at the instruction of a healthcare provider, employer, or government official. Individuals that need to care for a family member that has COVID-19 or is under quarantine. Individuals that need to care for dependent because of school closures, child care facility closures, or other similar types of care programs. Self-employed individuals that are temporarily unable to operate their business because of any of the above listed situations will also be eligible. According to officials, a request was officially submitted to the Administrator of the United States Small Business Administration to provide SBA economic injury disaster loans to small businesses across New Hampshire. Individuals will need to file for each week of temporary unemployment. This can be done online at www.nhes.newhampshire.gov or by the phone at 603-271-7700. Shortly after the new unemployment rules were announced, many people reported having problems accessing the website. State officials urged them to keep trying as they tried to address the issue. They said the phone lines were up and running. Restaurants shift to take out as COVID-19 restrictions take hold. Service personnel out of work as officials try to slow spread of virus. Let's take a listen to that video from WMUR News 9, Amy Cavino.
The New Hampshire Department of Corrections has immediate openings for corrections officers. Apply today.
It certainly would, Sharice. I can't see you, but I hope you've got green on. We're on South Main Street here in Manchester outside Francour's Cafe. They just closed a couple of minutes ago. They had about a handful of people coming in throughout the morning to pick up corned beef and cabbage to go for $8.95. Inside, though, it was empty, unsettling and sad, but this cafe mainstay has regulars. Then they trickled in this morning for their breakfast sandwich, their daily hot dogs made to order. People seem to linger a bit, happy for the contact, even if it's 6 feet away. Francour's has bussers and dishwashers and servers who are suddenly out of work. Just the line cook and Kelly, who has worked here for 4 years and is trying to remain optimistic. We saw on Facebook you're doing corned beef to go.
We are, yes. And we actually already have a couple orders come in this morning, so it'll be good. Once the word gets out there that we do a lot of takeout, hopefully people will come in. I think they're expecting us to be closed.
It's strange. I'm 88 years old and I've never seen this in my life. It's funny, huh? Mm-hmm. Even during the war, it wasn't this bad.
Claude Venn takes his hot dog burnt to a crisp. Francour's opens tomorrow promptly at 6 o'clock. Even if you're not a takeout person, now would be the time to try. We're live in Manchester this noon. Amy Cavino, WMUR News 9.
Okay, and there you go on that video and that report. Buses deliver school breakfast, lunch instead of picking up students. School officials say they want to bring meals to students who need them. Let's take a listen to that video from WMUR News 9, Ray Brewer.
School buses were rolling through the streets of Manchester, but instead of picking up students, they were dropping off meals. Leah Marney says this is a huge help given the current situation.
With everything empty in the stores, it's hard to come across stuff right now for him, and I want to make sure he can get everything he needs.
Aboard this particular bus, the principal and teachers from Beach Street Elementary School.
I have to say that I have the best staff I could possibly ask for. They took off their teacher hats, jumped right in. They've been doing everything they can for the kids.
An effort appreciated by the parents.
I know a lot of these teachers personally. I used to go to Beach, where my kids now go. So it's really nice seeing them. They care about the kids.
And Mayberry adds these meals are going to go a long way in helping them get through the crisis.
We really weren't planning for this for the month, and end of the month, a lot of people around here. We need this to survive.
Eventually, the buses will also be bringing homework assignments as well for the younger grades. But for now, students can still enjoy another day off.
We'll see you tomorrow, okay? No schoolwork yet.
This is part of the effort as Manchester, like the rest of the state, transitions to remote learning. Parents we talked to said the school so far is doing an excellent job of communicating with them. In Manchester, Ray Brewer, WMUR News 9.
Okay, and there you go on that video and that report. Salon cinema chain close doors to help control the spread of COVID-19. Employees let go aimed at concerns over the coronavirus. Let's take a listen to that video from WMUR News 9, Kristen Carosa.
Okay, mother and child in vehicle. Mother is unable to exit the vehicle.
The owner of the studio on Elm in Manchester is busy closing up her salon. She just made the decision on her own to close her doors.
This isn't about money. This is way bigger than us. It's bigger than money, and I knew that, honestly, I had to do the right thing.
And the right thing meant letting 5 of her employees go for now.
I know this decision was so hard for her to make. It wasn't easy. She was thinking not only about herself, but all of us, which she always does. So I know in my heart that when she made this call, it was because she had to.
Other businesses in the state are in similar situations because of CDC recommendations. Chunky's Cinema is closing its locations in Manchester, Nashua, and Pelham.
It's a difficult time for us, for our staff, for our suppliers. Luckily, everybody's very professional about it, and we'll get through this.
CEO Alan Coburn says their entire staff will be let go in the next 2 weeks, with the exception of some managers to maintain the 3 locations.
It's awful. It's the worst thing probably that we've ever done. It's a lot of sleepless nights, knowing that this could happen. It's just terrible.
Management is now directing employees to unemployment services. The salon is looking into that as well.
People need to start closing their businesses. We need to stay away from each other. We need to bring this to an end. But we're not, if people keep going out and keep getting services done, and it's not going to happen.
The salon owner here in Manchester is asking other business owners across the state to consider what they can do to help as well. Reporting in Manchester, Kristen Carosa, WMUR News 9.
Okay, and there you go on that video and that report. Coronavirus in Massachusetts. Tuesday, March 17th update. Let's take a look. The new cases, 21. Total cases, 218. In local transmission, 33. Maine CDC announces 15 new cases of coronavirus in state. 32 cases total. Let's take a listen to that video from WMTW News 8 Maine.
Okay, mother and child in vehicle. Mother is unable to exit the vehicle.
CDC announced that of the 32 positive cases of coronavirus in our state, one of those is actually a child under the age of 10. Now, the CDC says that that child did not attend a daycare center, and the CDC also says that although there are positive cases now with 2 children, one with a child under the age of 17, and as I said, a child under the age of 10, global evidence does show that the severity of the illness is not as severe for kids as it is for older people. Now, the average age of people with coronavirus here is 50 years old, and there are positive cases in 7 different counties. Dr. Shaw from the CDC says that at this moment, there's only evidence of community transmission in Cumberland County, but he does expect it in other areas. And out of 32 cases, 3 of those people are in the hospital, and 2, they also have the flu. The rest, they're self-quarantining in some fashion. So far, of all the testing that the state lab has done, more than 1,300 have come back negative for coronavirus. For now, I'm live in Augusta. Talia Clark for WMTW News 8.
Okay, and there you go on that video and that report. And let's take a look at your U.S. stock market and see how your U.S. stock market closed for this Tuesday evening. Your Dow Jones Industrial Average closed in the green and went up. Your Nasdaq closed in the green and went up. S&P 500 closed in the green and went up. Gold closed in the green and went up. Oil closed in the red and went down. US 10-year closed flat. Euro/USD closed in the green and went up. And VIX closed in the red and went down. Dow rebounds more than 1,000 points as Trump seeks $1 trillion in settlements for coronavirus fight. Stocks surged Tuesday, rebounding from their worst day in more than 3 decades as Wall Street cheered White House plans that could inject $1 trillion into the U.S. economy to crush the blow of the coronavirus. White House coronavirus response coordinator details new plans. Let's take a listen to that video from Good Morning America, ABC News.
Is the White House coronavirus response coordinator, Dr. Deborah Bix, who also helped lead the fight against the global AIDS epidemic for more than 3 decades. Thank you so much for joining us this morning. We heard the president and also in Whit Johnson's report, and we heard a change in tone in yesterday's briefing and stricter restrictions right now. What led to that, Doctor?
Well, our job every day in the task force is to bring the most recent data, our most recent scientific evidence from around the globe, and all of the new models that we've been working with modelers on to really understand what elements of mitigation at the community level could have the biggest impact on stopping the spread of the virus, really, again, to protect our older generation and ensure that they don't become infected.
And that is paramount. We saw in Whit Johnson's piece also what the president was talking about, and we hope that you can give us a little clarification when he said that the emergency mode, as he put it, washing through by July or August. What exactly does that mean?
Well, it's really important to look at the scientific evidence that we have available right now. When you look at the China epidemic and you look at the South Korean epidemic, you can see the duration, when you reach peak and how long that peak lasts, and when the number of cases start going down because of the efforts you have made. Now, when we talk about it, I just want to be clear, the efforts that we're talking about, because as you covered just now, we don't have a vaccine yet, and we are still working on therapeutics. So that one effort we can have is every single American taking responsibility and making those sacrifices that you covered also in the first segment.
And you believe the key right there, millennials. Why is that?
I do. When you look at data, it's very important to integrate both health data and public health data and cases with census. And if you look at every large city across America at the census bar graphs, you'll see that in every single case, the largest numbers, about 22% in many cities, are millennials. The millennials are incredibly good about getting information out in a clear way, but more importantly, they are incredibly good about understanding how to protect one another, how to protect their parents, and how to protect their grandparents. Right now, we need the army of millennials out there doing everything that they can to protect themselves from getting infected, because we know a lot of their cases will be mild or asymptomatic, and making sure that they're doing every single precaution to protect their parents and grandparents.
That's an excellent point there, Dr. Birx. And as we said, and thank you for this, for decades you have led the fight when it comes to AIDS, and we appreciate the work that you have done. How well do we know? Can you assess this virus for us? How much do we know?
Well, we know a lot more than we knew in the early days of HIV. Those early days of the early 90s, when really the only ones really out there and fighting for one another and for what they needed were the people who were at greatest risk. You know, it was really inspiring to me to watch people who were sick themselves going to the street, not because it was going to help them, but because it would help the group coming behind them. They were already too ill. I guess that's what I'm asking every American to do now, to do whatever they can to help the Americans ahead of them, to make sure they don't get infected.
Oh, well put. Well, Dr. Deborah Birx, thank you very much, and I know that we will be checking with you from time to time, and we appreciate you giving us some time this morning. You take care. Well, hey there,
Okay, and there you go on that video and that report. And that does it for this evening edition of the Riley King Newscast, right here on the Riley King Network. I hope you all have a great rest of your evening. I'll see you back here tomorrow for another newscast. And I'll have a news report coming up in a little bit. Good night and bye, everyone.